Good afternoon. I'm Clark Sturdivant. I'm a high school science teacher and data nerd from here in USD 259. I'd like to take a couple minutes to talk with you about the Sedgwick County COVID data and some of the numbers from our own district. Let's take a look. The chart here on the left should be very familiar to all of us. This chart is provided by the Sedgwick County Health Department, and it's what we use when we make our decisions about safety. What are some good things about this chart? Well, the data is filtered to exclude clusters from prisons and nursing homes. The lower frequency of average calculations here means it's less uncertain. The averages are only calculated once a week. That means the numbers have had more time to settle. The data has had more time to come in. This also includes case rates, and case rates are such an important epidemiological tool. Next, what are some cons? Well, that lower frequency of averages means that this has less predictive power because by its nature, we're looking further in the past. We're looking further in the past. This has no data on hospitalizations, nor does it have any data on available ICU beds. Let's take a look at this other data visualization. See what we got going on here. This visualization is also produced by Sedgwick County. It's based on the same data. It just looks different because it's designed for a different purpose. Let's look at some pros of this view. Well, it's updated daily. That means it's better for looking into the future, right? We're not as looking into the past here. We're looking more towards what's going on right now. It includes hospitalizations and information on ICU beds, and it's got a data visualization, right? The chart is not as good of a visualization as a graph. What are some cons with looking at this data this way? Well, there is an increased uncertainty, which tends to kind of wash out in the end. But there's increased uncertainty because, for example, the data from today isn't complete yet. So the percentage from today isn't complete yet. So this rolling 14-day average may change a couple tenths of a percent for today based on updates in today's data. Also, this doesn't really display case rates here. So which one's better? Neither. They're different. They're a different tool for a different purpose. And in fact, for the task we are looking at for trying to predict what's coming and get a solid metric of where the community sits, you need both. You need both. Let's take a deeper dive into some numbers that appear here on this chart from the health department, and let's compare some similar numbers from within the district. Last week at the meeting, we heard about a case count from the district, and that was compared to a case rate from this report for the county. There's a problem there, though. You cannot compare a case count and a case rate. They're a different number. A case count is just a tally of how many people have had it. A case rate is a rate. It's per 100,000 people in this case. That's the standard. Okay? So that was apples and oranges. We can't do that. That's not fair. What you would need to compare, okay, for an example, would be the case count from the district or the case count for the county. Now, in this case, I'm reporting the case count from the district for pre-K through 12 staff who's allocated to a school building. So this is not including administrative staff. This is just staff at pre-K through 12 buildings. And that information was obtained from KSDE. So we reported 50 cases. The same week, the county reported 1,542. But even then, that's not super instructive because the population of the school district is so much different than the population of the county. Instead, let's look at the rates. Okay? So the rate for the county, like we said, was 295.4. If you calculate the rate for a pre-K through 12 staff, the case rate per 100,000 is 1,150. That's 3.9 times the case rate for the county. It is 3.9 times more dangerous to be a school staff member here than it is to be an average community member here. Now, there are demographic reasons why those numbers aren't perfectly comparable, but if the comparison wanted to be drawn, that's the comparison to make. It's almost 4 times more dangerous to be a staff member at one of our schools than it is to be an average citizen. Another metric you might look at is the cumulative case rate. For Sedgwick County, we've reported 14,822 cases out of a total population of 516,042. For our school staff, again, that's school building staff, we've reported 198 cases out of 4,289 school building staff. 117 of those were at primary schools, and 81 were at secondary. I threw in the 30 other there to look at just so you could kind of get a scale for how many the admin staff are having, but they are not included in this calculation. Sedgwick County cumulative case rate is 2.87% based on those numbers. USD 259 school staff case rate is 4.6%. This should be even more worrying because the USD 259 numbers are only from August 3rd. The Sedgwick County numbers are from the whole pandemic. Okay, so again, it's still more dangerous. It's 1.5 times more dangerous here to be a USD School 59 staff member than it is to be a member of the general public. Again, this is less precise than the case rates we were looking at earlier because this cumulative, we're not measuring over the same time period. Now let's look within that data just from the district and compare elementary to secondary. On this chart, we have the cumulative COVID case counts over time since August 3rd. The blue line represents elementary staff. The red line represents high school staff. The green line represents middle school staff. Now, this data has not been normalized, but even in this raw form, you can tell that the elementary staff is skyrocketing much quicker than the high and middle school staff put together. This might be related to the fact that our elementary students are back face-to-face. It might not be, but you were asking for evidence within the district that there might be spread occurring at schools. This is it. You can see it right there. Watch here in the last couple weeks. That is when kids reported back to school. That big jump there, that's when kids reported back to school. That's Labor Day. Okay, so when the kids came back, there was a huge spike in staff cases, especially at elementary schools. There it is. See that? That's the jump of kids being there. Finally, there are 0 ICU beds available in our community right now. There are 0. If you were to get sick from this and need ICU care, you could not get that here. Let's take a quick overview. The weekly case rate for the county is 295.4. The weekly case rate for our USD 259 school staff was 1,150. The cumulative case rate for the county was 2.87%. The cumulative case rate for our USD 259 pre-K through 12 on-site staff was 4.6%. ICU beds available to the county, 0. ICU beds available to USD 259, still 0. These are my data sources. Everything was either from Sedgwick County or KSDE. I will be providing the data set as well as further analysis over time. Thank you for your time. I realize you have important decisions to make, and I know that you're taking them very seriously. Have a great evening.